IM injections are one of the most frequently used medical procedures and are fundamental to nursing care. The WHO estimates that roughly 12 billion IM injections are administered throughout the world on an annual basis. So how do you do it? The goal is to maximize the therapeutic effect of the medication and eliminate or minimize the complications and discomfort from the IM injection. Improper injection technique could lead to lack of medication efficacy, so it is important to ensure that IM injections are administered correctly. The nurse needs some knowledge of pharmacology, anatomy, and physiology. The nurse also needs to be able to do several assessments. As well, the nurse needs to select the most appropriate needle size, length, and injection site. For each site, the nurse should know how to properly identify the site by using anatomical landmarks and should be familiar with potential complications inherent at each site. IM injections should be given into the densest part of the muscle at an angle of 90 degrees. Before undertaking an IM injection, the nurse must be able to assess their competence in all aspects of injection techniques. The nurse should also be able to rationalize the procedure to the patient, requesting consent when initiating treatment by IM, and giving any necessary advice during the procedure. Correct injection technique, including the use of Z-track if applicable, and rotation of injection sites are essential. When considering correct technique and appropriate injection sites, there are several influencing factors, including the age of the patient, the type and volume of medication to be injected, the general condition of the patient. This includes patient body mass and weight, as this will dictate the length of the needle to be used when giving the injection, patient preference, and the policies and procedures of the treating institution giving the IM injections. The injection volume will depend on the muscle depth. Small volumes of medication, 2 milliliters or less, may be given in the deltoid site, whereas large volumes of medication, 2 to 5 mLs, should be given in the gluteal site. Let's review 4 main muscle sites utilized for IM injections: the deltoid, the dorsal gluteal, the ventral gluteal, and the vastus lateralis. Injection site selection is critically important because the medication effect can be enhanced or diminished depending on the site of injection. However, each injection site presents its own advantages and disadvantages.